Hi students, welcome to our sessions in oral pathology. In this video, we are going to see Sjogren syndrome. Okay, so Sjogren syndrome is a very small topic and very important also. You may have heard about Sjogren syndrome and you may have read in the UG, but that is not suffice for your NEET PG examinations. Okay, so in NEET PG, they ask many other things in the Sjogren syndrome. So let's have a quick discussion about Sjogren syndrome. It will be a small video and this will cover up I will cover up maximum questions they can ask you in this Sjogren syndrome. Okay, so Sjogren syndrome is actually, what is a Sjogren syndrome? It's an autoimmune disorder. It's an autoimmune disorder and it is chronic. Okay, chronic. It's a chronic immune disorder and it will affect other organs also. That way it is systemic. Okay, so it's a chronic systemic autoimmune disorder. So now you know that it is chronic because it will take a lot of course of time. It will affect other parts of your body, other organs also. That is systemic, and it is autoimmune. Autoimmune means you know that our own defense mechanism is acting and it's our own system, right? Our own body. So it is autoimmune disorder. Now, what are the main things you can see in Sjogren syndrome? In Sjogren syndrome, the main thing you can see is that your salivary gland and your lacrimal gland. Okay, your salivary gland and your lacrimal gland are affected. How they are affected? The all the WBCs, what all the WBCs, your lymphocyte, they will infiltrate into the gland. Okay, these WBCs, these lymphocytes, they are going to infiltrate into the gland. They are going to destroy your acini, and what will be the result when the acinis are destroyed? There is less production of saliva or less production of your lacrimal gland, that is tears. Okay, the tears are less produced, the saliva is less produced, you will feel dryness. Okay, dryness in the oral cavity, dryness in the eyes. So this is the result. Okay, so it is an autoimmune disorder where your lymphocytes are destroying your own acini. So salivary gland acini is destroyed. Okay, both of the lacrimal gland acini, they are destroyed. So what happens is that there will be reduced production of saliva. Okay, there is reduced production of your tears. What happens? You can see dryness. So dryness of the mouth is called a xerostomia. Xerostomia. It will result in xerostomia. And dryness of eyes is called a xerophthalmia. Ophthalmia. Okay, ophthalmic is something related to eyes. So xerostomia and xerophthalmia, that is causing dryness. Dryness, this much dryness, you will feel like sand in the oral cavity. Okay, dry sand, or it is like sicca. Okay, that is why we say it is sicca. Sicca syndrome. Sicca is something related to sand, dry sand. So you will feel that much dry in your oral cavity, and your eyes is like dry sand. That is called conjunctivitis sicca. Keratoconjunctivitis sicca means there is keratinization because of the constant irritation. Okay, so this is two things will happen. If these two things are there, we call it a primary Sjogren. Primary Sjogren. So xerophthalmia and xerostomia, they combined, the syndrome is called primary Sjogren. But we call it is a systemic also, right? It can be systemic also. Along with this xerophthalmia and xerostomia, if you have any other extraglandular symptom, okay, these two are affecting your glands. Okay, these two are affecting your glands. If you have any extraglandular symptom, means you have xerostomia. Okay, you have xerostomia that is affecting your salivary gland. Your xerophthalmia that is affecting your lacrimal gland. Now these are glandular symptoms. Now along with that, if you have any extra glandular symptom, okay, you can say it as, now it is called secondary Sjogren. Secondary Sjogren. Now what are the extraglandular symptoms which you can usually see? Most commonly it is your rheumatoid arthritis. So this was a question, previous year question in your NEET. Which is the most common extraglandular symptom? Okay, which is the most common extraglandular symptom you can see in Sjogren syndrome was a previous year NEET question. Right, rheumatoid arthritis. What others you can see? You can see SLE. These are all autoimmune disorders. Okay, SLE you can happen. Scleroderma. Scleroderma, you can see polymyositis. Polymyositis. Myasthenia gravis. Myasthenia gravis, Raynaud's phenomenon, okay, Raynaud phenomenon. Okay, all these can be seen. Most commonly, your rheumatoid arthritis. Please note rheumatoid arthritis. That was a previous year question, NEET question. So this is secondary Sjogren. Now, we know that this is due to your autoimmune disorders. What are the genetic factors? What are the genetic factors which are related to this Sjogren syndrome? Your HLA, human leukocyte antigen, HLA-DR3. Please remember this because this was once asked in a INICET question. HLA-DRW52. This was in the option. HLA-DRW52. This was in the option actually. Okay, HLA-DRW2. These are the HLA factors or genetic factors which can cause Sjogren syndrome. Others, some question papers say that the virus which can trigger the Sjogren syndrome is your Epstein-Barr virus, EBV. Sometimes EBV infections can trigger your Sjogren syndrome. Now, my question is: we have Sjogren syndrome, we have xerophthalmia, we have xerophthalmia, but how can you diagnose? How can you diagnose? Now, the patient, how the Sjogren syndrome patient will come to you? Okay, so from the person coming to the clinic till the diagnosis. Okay, just imagine that you have a person or you have a patient Sjogren syndrome coming to you, and I have told you that Sjogren syndrome autoimmune disorders are more common in which population, which gender? Female genders. Okay, autoimmune disorders are more common in female genders. Okay, so what we see, where patient is coming, to the clinic. Okay, and what you can see is that you can see swelling of her gland. Okay, mainly if you see the parotid gland, the swelling, you can see swelling of her glands. And what about the swelling? The swelling will be larger on one side, smaller on one side. So it's called asymmetric swelling. Okay, asymmetric swelling. And she says that sometimes it increases a little and sometimes it reduces a little. So it is non-persistent. Okay, it is non-persistent asymmetric swelling. Okay, it is asymmetric. The swelling is small and large, size variation is there. It is reducing and then increasing. It is non-persistent. Patient doesn't have any painless. So this is the first thing. Seeing the patient, you are going to have a clue. Okay, so there is asymmetric, non-persistent, painless swelling of your salivary gland. Okay, you have seen that. Next thing, what you are going to see, you are going to ask the patient about symptoms. Do you have dryness in your eyes? Do you have dryness in your mouth? Yeah, I have xerostomia. Yeah, I have xerostomia. I have xerophthalmia. Okay, xerophthalmia you have. Nice. Okay, so we have a clue that this can be. But xerophthalmia can be due to other reasons also. We don't know. We are not sure. We are cannot assure that this person is having a Sjogren syndrome. So what we will do? We will do certain test. Okay, so these tests are very, very important. Now I will tell a technique to memorize this test. Okay, now imagine that a Sjogren is a female. Okay, so Sjogren syndrome, autoimmune disorders usually come in female. So Sjogren is a female, Sjogren is a girl. Okay, so she had a boyfriend. Okay, what's the name of her boyfriend? Shimmer. Okay, Shimmer. Shimmer is the boyfriend's name. Okay, Shimmer. He's a very nice person. Shimmer is a very nice person, and Shimmer is a good quality person. Okay, but what happens that they were having a very good relationship, and actually they had a breakup, just like others. Okay, just like other couples, they had a breakup. Okay, they had a breakup. So Sjogren, they were having she was having a boyfriend called Shimmer. He was a very good quality person, but somehow they got a breakup. Okay, some small problems with them, they got a breakup. So anyway, when you get a breakup, you too may have got any breakups in life. I know that most of the people, they may have once in a lifetime, they will definitely have a breakup and all. Okay, right, that's nice, that's okay. Okay, so when you get a breakup, you will smile or you will cry. Okay, you're gonna cry. Okay, if it is a first love, you're gonna cry. So anyway, you're gonna cry. So breakup time, it is about your tears. Okay, breakup time, it is tear breakup time test. Okay, tear breakup time. Okay, so in the time of breakup, you are gonna cry. That is tear breakup time test. That is TBUT test. Okay, TBUT is tear breakup time test. Okay, now they got a breakup. Shimmer is a good quality person. I told you he's a good quality person. So he cannot. We boys, we cannot take much pain in the heart. Okay, we are soft hearted people. Okay, so what this Shimmer is doing that to make her girlfriend Sjogren happy. So he is bringing a rose from the Bengal. Okay, he is bringing a Bengal rose, a rose from Bengal test. Okay, so then he is bringing a rose from Bengal, rose Bengal test, rose Bengal dye test. Okay, he's bringing a rose Bengal test. Now, what happens? He gave the rose to the lady Sjogren, but no way, she is not happy with this rose. Okay, she's not happy with the rose. So what he does, he brings a saxophone. You may have seen a saxophone with the blowing that saxophone. Okay, saxophone is an instrument to blow to make a music, right? So he brings a saxophone, that is saxophone test. Okay, saxophone test. He makes a saxophone test. So you can see that Shimmer, breakup time, Rose Bengal, and saxophone. Shimmer is a quality person. It measures the quality of the tears. Okay, it measures, it looks for the quality of the tears. Breakup time test, actually it tests for the lacrimal gland. Okay, the function of the lacrimal gland, how much quantity, okay, how much quantity of tears, how much quantity of the tears it is coming. Okay, breakup time test. Rose Bengal dye test, it is mainly look for your dryness of the eye. Okay, Rose Bengal dye test, it will look for corneal ulcers. Corneal ulcers. If you should handle the rose very carefully, or else it has thorns, it will prick your eyes. Okay, so this Rose Bengal, if you are handling the rose, it has thorns, it will prick your eyes, so it will cause ulcers in your eyes. So Rose Bengal dye test is used to see corneal ulcers. When the eyes get dry, there will be ulcers forming. So how much amount of ulcers is formed? If there is any presence of ulcers, we used to check Rose Bengal test. Okay, then saxophone test. So saxophone test is saxophone is he's blowing that instrument. So what tears, the saliva will come out, right? When you are blowing an instrument, the saliva will come out. This will saxophone test will quantify your saliva. Okay, how much saliva is formed. So we are checking for the symptoms of your Sjogren syndrome. Okay, so Shimmer has done everything. He got a breakup, but he bought the rose, he bought the saxophone, and but she's not happy. So what he is doing, he's taking a photo of her. Okay, he's wanna go do a photo of her. He's bringing a very cherry blossom photo for. He's going to do a cielography. A cielography. Cielography. In cielography, what do you see? In cielography, he's going to take a photo with her. That is cielography. And in the photo, they are very happy. Okay. In the photo, what they are seeing cherry blossom. Cherry blossom. Cherry blossom appearance in cielography. So that's their old photo in their nice time. But now this girl is not willing for any what willing to be happy. She is not happy with anything. So Sjogren has tried his all the way to make his girlfriend happy. But what happens? He is not happy with it. So what else? What is the conclusion? What can he do? Okay, chalo, just break up. That is cut this relation away. Okay, cut this relation away. I'm gonna cut it biopsy. Okay, biopsy. The final thing is biopsy. Okay, cut it. There's no use. I did a breakup time test. I did Rose Bengal. I bought a saxophone. I took a photo with you with the cherry blossom and all. But still, if you are not willing, I do a biopsy. And biopsy, how you do a biopsy? I do a lip biopsy. Up do a lip biopsy, and I will take a small bit of a 4 mm of tissue from the lip, and I will see for a minor salivary gland. Okay, I will check the minor salivary gland. I will see how much lymphocytes have inside this minor salivary gland. How many lymphocytes are infiltrated? If there is 50 lymphocytes, if there is a collection of 50 lymphocyte, that is one focus. One focus. 50 lymphocyte makes one focus. One focus is necessary. One focus is adequate to say that there is Sjogren syndrome. Okay, so this is how you test. Shimmer test, breakup time test, Rose Bengal test, saxon test, cielography, biopsy. Okay, so that is a test. Now, along with that, you can do some blood examination also. Okay, blood examination, you can do blood examination also. In the blood, what all things you can see in the blood examination? If you take the serum of the patient, you can see anti-nuclear antibody, ANA antibodies can be seen. That is anti-nuclear antibodies. What are the anti-nuclear antibodies you see in Sjogren syndrome? Anti-SSA, anti-SSB. Okay, so this is actually the blood of that shimmer. Okay, blood of that shimmer. He's having this anti-SSA, anti-SSB. He will be depressed. Okay, he will be crying because his girl left. So anti-SSA is anti-Rho. Okay, anti-SSA is anti-Rho, anti-Rho and anti-La. So I say role. Okay, ro to cry. Ro is in Hindi, it is cry. Okay, it's like role. I mean, he can only cry because she's gone. Okay, so you can in the blood you can see anti SSA, anti SSB, NA antibodies. There will be rheumatoid factor. Rheumatoid factor can be seen increased in your blood. You can see ESR is increased. Okay, ESR is increased. Your immunoglobulin G, IgG is increased. All these are certain findings in the blood. So this is Sjogren syndrome. I hope this is clear to you. Okay, Sjogren syndrome. We have seen Sjogren syndrome, and please remember it is an autoimmune disorder, chronic sclerosis, chronic systemic autoimmune disorder, and it can affect your salivary and lacrimal gland, xerostomia and xerophthalmia. That is primary Sjogren. You have one extra glandular symptom, then it is a secondary Sjogren, mostly your rheumatoid arthritis. The genetic factor is HLA-DR W52, and how the presentation and the diagnosis is the question. Okay, so there are so many questions from this part. Okay, so the swelling is asymmetric. Please remember, asymmetric non-persistent swelling. They will give you a clinical clue that the person is coming with a symmetric persistent swelling. Okay, symmetric painless swelling. Okay, symmetry, if the swelling is symmetric and if it is persistent, it is Mikulicz disease. Okay, it is another one. It is another autoimmune disorder, that is Mikulicz. Okay, Mikulicz disease. In Mikulicz disease, the swelling is symmetric. Both sides will be similar. It will be persistent. Okay, once you get it, it is there, and it will be painless. Okay, so and these are certain difference between Mikulicz and Sjogren. Okay, so that is one thing. You can get a question where there is symmetric non-persistent or persistent swelling. Okay, please note this, and you can get xerostomia, and the treatment. Okay, I hope you are familiar with the treatment. Shimir, what breakup, then rose bengal, saxone, cialography, biopsy, and the blood examination. Okay, so this is about your Sjogren syndrome. Okay, should please you can collaborate with the okay, you can compare with the Mikulicz disease also. Okay, you can compare with Mikulicz disease and learn. Okay, I hope this is clear to you. Okay, see you in the next video with a new topic.